In the clinical setting, I know emergencies can happen at any time, so even though I haven't personally experienced a major emergency, I try to stay prepared ahead of time. One of the main things that I focus on is really just paying attention to my patient throughout the session. Especially right now in the acute setting that I'm in at LMC, I make sure that I'm checking their vitals. Um, and I not only just do that, I look at their facial expressions. I check if they're in pain. I ask them if they're in pain. I see if they're sweating more than usual or if they say something that feels off. I also make sure to document everything. Um, I feel like those small signs can also tell you a lot before something more serious happens. Another big thing for me is staying calm and thinking about what needs to happen first. I think it's really important to quickly assess the situation and then call for help right away. For example, like the hospital that I'm in, we have an entire team around us and we can alert staff immediately. And they usually know the protocol, but um, typically it's good to know the protocol before anything major happens. So it's also good to ask questions like that. And if I were in an outpatient setting, I would most likely call 911 right away immediately and assure that my patient would be safe and not left alone. Um, so yes, I also think it's really important to just be familiar with the clinic or hospital that you're in, like knowing where emergency equipment is and what the protocol is, so that you're not trying to figure it out last minute or like in the moment. Overall, I just try to stay aware, stay calm, and use the resources around me to make sure my patient is safe.